Hello and welcome. This is View from the Top. I'm Modele Sharafa Yusuf. Corporate social responsibility, or CSR, began to surface in the early 1950s when academicians and business leaders identified the significance of business decisions in the context of community welfare. They concluded at the time that corporate health is conditioned by and dependent on the health of those individuals and internal systems that comprise the corporation, as well as the health of the human and natural context in which the corporation operates and from which it draws life. When the pandemic hit, Nigeria's private sector-led coalition against COVID-19, also known as CACOVID, rose up to the occasion, building isolation centers and buying medical and other consumables. This week, CACOVID formally announced the flag-off of a nationwide distribution of food palliative and other relief items to mitigate the adverse effects of the novel coronavirus on vulnerable Nigerians. The food relief materials from which the private sector operates are spending about 23 billion naira, will cover 1.7 million families, amounting to about 10 million people across the 774 local governments in the country, including the Federal Capital Territory. CACOVID administrator and CEO of Aliko Dangote Foundation, ZOUERA YOUSSOUFOU, joins me on View from the Top to discuss this and other initiatives. Thank you, ZOUERA, for joining me.
Thank you so much for having me.
And thank you for tuning in. ZOUERA, the financial reporting and shareholder value have always been the primary objectives for public companies. However, corporations today, as we know, have become increasingly conscious and accountable for their actions beyond the scope of financial viability. What part do you think this played in the CACOVID initiative?
So I think it is absolutely true that companies have always had to go above and beyond just, getting shareholder value and making money for the owners. The reality is doing good, supporting the community, having your social license to operate be intact has always been part of what business has known to do, which is why most companies have CSR departments. A lot of companies have corporate foundations, which take things, I would say, a step further. And so the idea of the private sector convening around this idea of supporting Nigeria in the middle of the pandemic crisis was a very easy and natural move for the private sector in Nigeria, the organized private sector. So really what it was, when Herbert Wigwe, MD of Access Bank, and Aliko Dangote started talking about their different initiatives. On our side, Aliko Dangote Foundation, we had already started working with the NCDC to support the case management and port entry related requirements to deal with the disease. When the two of them got together and started talking about, well, what are we going to do? So we should get others. We should get the other private sector players to join us. And so with the help of the CBN governor, who ended up chairing the whole CACOVID setup, we really were able to gather all the big private companies that everybody knows in Nigeria. So from all the top banks, the Access Banks, GT Banks, UBA, Zenith Bank, FBN, all the way to fast-moving goods equipments, to companies like Promasidor and Flour Mills of Nigeria, BUA, etc. All these companies got together and raised a staggering amount of money in a very short time. And I think it was just a natural thing for them to do, given that this is happening in our country. And as we're watching the crisis unfold globally, we all knew that it was something that we needed to do as the private sector to support.
Yeah, for clarity, how much exactly was raised?
So right now, we've raised over 30 billion naira. We've spent about 40 billion. So in other words, we've made commitments that will, of course, be completed. They're about 40 billion naira. In that 40 billion naira, you have the 23 billion for the food palliatives that we just launched this week. And you also have the isolation centers, which we set up in 36 states plus FCT. You have the communications work that we've done, the testing supplies that we've purchased, to test up to 600,000 Nigerians, and everything that we've done around communications. So raising the the awareness from the grassroots campaign that we've been doing to, really trying to promote across the country the principles of fighting COVID, which are hand washing, social distancing, sanitizing.
So what are the plans for making up the shortfall?
Well, the same, the CACOVID leadership, the CACOVID membership will absolutely, I'm not even calling it, it's not a shortfall. When you say what we've raised, I mean what we've put on the table to say this is what we're doing, that was that initial 32 billion. But however much money we need to raise is what the organized private sector will raise. So
there's an ongoing commitment. There's an ongoing commitment to this.
Yes.
So how easy was it for the private sector to join hands with the public sector to work on this?
So I would say we had really good partners on the government, on the public side. So we had an excellent relationship with the Nigerian Center for Disease Control. Dr. Chikwe Ikekwazu has been an amazing partner. We have a very good relationship with the Presidential Task Force against COVID-19. Dr. Sani Aliyu, who's the coordinator, we have a very good relationship with him and his team. We've worked very well with the SGF, who chairs that PTF. We've had very good cooperation with the governors, right? So this whole, setting up isolation centers in their states and bringing palliatives to their states requires their collaboration and input. It wasn't difficult. I think the hardest part was trying to source, first of all, the goods. So testing, if you remember, there was a huge demand globally for testing supplies, and there are very few companies in the world that were making this. So we were scrambling in the middle of the pandemic to try to put Nigeria's voice on the table and get more testing supplies for Nigeria. That was a challenge. Another challenge was literally the sheer volume of these 23 billion naira worth of food supplies. We're trying to get this food in the middle of the lockdown, where factories and manufacturers have reduced the number of people on the factory floor. They're trying to implement social distancing measures. There's lockdowns across the country. It was really hard to get the food from point A to point B and to actually even get the manufacturers to supply such a huge order, which is why it's taken us this much time to get to the point where we're ready to distribute the palliatives. Talking
about distribution of the palliatives, tell us exactly how you plan to do this and how exactly you will ensure the things get to the most vulnerable in society that they're meant for.
This is the biggest question that we always get. And so what we've done is, imagine this, the distribution is in 2 phases, right? So phase 1 is the flag off. Flag off means we formally hand the goods over to the state. So this is a ceremony, it's photographed, it's filmed, the media's there, the different local chair people are there, the CACOVID representatives are there, and the state representatives are there. So once we do the flag off and we specifically detail what each state received, the next step is doing the actual distribution within the states. So we've developed a very systematic system to really make sure that the food gets to the ultimate beneficiaries. This means, what it literally is the state governor sits on top of the food distribution committee. There's somebody who is in charge in each local government area. So there's a state task force, there's a local government level distribution system. And on top of that, CACOVID has our representatives and also our M&E partners. So we have a monitoring and evaluation team that will follow and make sure that this distribution happens across all of the 774 LGAs in Nigeria. As you can imagine, this is, again, another massive investment and infrastructure, because trying to move the logistics of moving food from the warehouse to the state to the local government areas is something we're going to have to do. And we have a system that we have agreed between us and the states on how to make sure that we do this. And everything will be documented, because as you can imagine, we are accountable to our funders. So the people who gave us money, this isn't like me doing it by myself, or the Aliko Dangote Foundation doing it by ourselves, or CBN governor doing it by himself. No, we're accountable to all the 109 organizations that contributed to the CACOVID fund. So we have to make sure that we report back to them that the food has been properly distributed. But this is going to be another massive effort, so we'll be talking about this for the next month or so.
As you said, CACOVID has helped to reinforce the testing capacity of the NCDC. Tell us more about that effort, as testing is critical to getting this under control and eventually putting this behind us.
Okay. So one of the things that we learned early on is that within CACOVID, we had private sector leaders who could make things move and who had money they could contribute, but we also needed some intellectual leadership on the topic of COVID-19. So we set up a technical committee that had in it the Bill and Melinda Gates Foundation, WHO, we had in there the PTF, we had Dr. Sani Aliu on there, Dr. Chikwe, we had Professor Christian Happy, who was the person who who sequenced the COVID-19 genome here in Nigeria. So we had a group of people who knew what testing was, how it was going to be organized, how do we do it in Nigeria. So that was step one, to get that committee together. And that's when we realized, for instance, the rapid tests were not the way to go. They don't, the viability of the results wasn't really good. We weren't getting, with the rapid tests, we weren't getting enough accurate results. And therefore, we were going to only purchase PCR-based, so this is microbiology-based tests, where you're literally taking the DNA of the virus, mixing it with our human DNA. That means that we're taking samples from the nose and from the throat to test people. Those tests were really expensive and really hard to get because, remember, we're competing with Italy and with the US and with, every other country that was trying to get these supplies. So we spent over 3.5 billion naira buying supplies. We have a 1.5 billion naira agreement with the UN to source specific cartridges from several companies, including Roche. We bought some VTMs. VTMs are the things that you collect, that you carry the sample. When you collect the sample, you have to put it in a little, we call it a little cup that you carry to the lab. So everything from the swabs, the nose swabs, to the plastic containers, to the reagents, to everything related to the testing supply, we purchased all of that and gave it to NCDC for them to now distribute amongst the labs in Nigeria. Like, we weren't the ones picking which lab got what supply, right? It was, we would purchase this is what NCDC is using, this is what Nigeria has as a guideline, and then they now go ahead and distribute over to the different labs. And so we were able to increase our capacity to test. So far, we've had about 300,000, we've ordered 600,000, but we haven't been able to receive all of them because they come in sequenced order. And, companies are producing these test kits as fast as they can, and we're getting them as they get delivered. Voila. So we're still going to be getting some more testing supplies in the coming months. But that was a huge effort. So NCDC, had started off with just 5 labs in Nigeria. Now they have many labs across the country, including their own lab here in Lagos. Yeah. We have private labs that have now been accredited in Nigeria, in Abuja, across the country. So we have a lot more capacity to test. So the challenge is to get more supplies for these labs to be able to do the testing.
What about vaccines?
So right now, there are no vaccines for COVID-19 yet. What we have is we have about 27 separate efforts that are ongoing trying to identify a vaccine for this virus. The most advanced are in phase 3. There's 4 phases to get a vaccine ready. Now, the truth is... How
are we planning to stay ahead of that curve? That's the question I'm asking.
So our job, and what we've been looking at within CACOVID is how to support African and Nigerian researchers and scientists on working on testing and vaccines. So we have a few efforts, 2 specifically, one in South Africa, and a couple that are supported by the African Union CDC, to see how can we, in Africa, develop our own vaccine, or how can we contribute to procuring vaccines for Africans, and then 2, to be able to develop rapid testing kits that actually work. Right now, the problem is that the kits were not the right type of kit. But if the kit is developed here and is validated by us here in Africa, this will allow us to be able to test more and more people. But in terms of the vaccines, there's two tracks. One is for us to find a way to put Africa on the map for getting these vaccines as they get developed. And two, to support our own labs and scientists and researchers here in Nigeria who are really making a huge effort to try to find things. Professor Christian Happy, who I had just mentioned a few minutes ago, runs a lab at Redeemers University in Ede, and they're working on a vaccine, so we work very closely with him to see how we can support and make sure that, you know, as they get closer to a solution, that we absolutely are able to take advantage of that for our people.
At the press conference you addressed this week, you mentioned that the coalition is primed to commence the third and final phase of its COVID-19 response plan. What would that be?
So that's exactly it. So we set off to do three things. The first thing was to increase testing, which we've done. The second thing was to set up isolation centers, which we've done across the country. The third thing was to provide palliatives for the most vulnerable people. That's what we're doing now. So the next phase of the CACOVID intervention would be using our resources and our connections to drive the research agenda for both testing and vaccines. That's the next thing that we intend to be involved in.
On a personal level, what have been your reflections on the impact this pandemic has had on the country?
It's been really difficult. I think we live in a country where, you know, COVID was it was just one more problem to deal with, right? If you think about the things that kill people in Nigeria, malaria is one of our biggest killers, right? So over 300,000 people die every year of malaria in Nigeria. So far, we have less than 1,000 people who have died of COVID-19 in Nigeria. But it doesn't mean that COVID isn't real. And it also has highlighted to us the contagion and the disruption that COVID has caused, malaria hasn't caused. So a couple of years back at the Aliko Dangote Foundation, we did this study to see what the impact of malaria, absenteeism, et cetera, was on the economy. And we were losing, on average, $1.5 to $2 billion of GDP in Nigeria from malaria. But if you look at how much we've lost from COVID-19 from March until now, it's a lot more than that. If you look at how it's disrupted the global supply chains of everything, COVID has had a huge economic impact on the country and on the world, right? So we live in a world, so we're connected with everybody else. So, you know, the challenges that other people are having are the same ones that we're having. I think the biggest difficulty has been how do we maintain our economy and our economic growth and our economic stability while dealing at the same time with the impact of the virus. And it's not easy, obviously, because we're still struggling with, you know, economic downturns. While we're seeing some of the cases reduce in some places, we're seeing them come back up in other places. So we're still not where we need to be in terms of testing and in terms of, you know, really flattening the curve of this virus across the country.
Despite all those challenges that Nigerians have faced, we really have seen the remarkable community spirit that was on display. But could we have done more?
Well, we can always say that in retrospect. We can always say that we could have done more, but I think we've done an amazing job. I mean, not just because I'm working with CACOVID now, but the willingness of people to come forward and to contribute huge sums of money for the betterment, not even of themselves, but of others, and so that we're all better off, I think has been amazing. I don't think any private sector in any country has done as much as what the Nigerian private sector has done, definitely not on the African continent. The other thing is, I think if we, you know, we've been very engaged with the government, because it's not like we're trying to have a separate intervention that's not coordinated or coherent with what they're trying to do. But, you know, the fact that the Nigerian private sector has been able to spend 40 billion naira between March and now, I think is a huge testament to how much we've really done, and we should be proud of ourselves. And I'm really proud of what I've seen our organized private sector do. Of course, we can always say we can do more, but I think we've already done a lot.
How can we work our way out of this to create a better and more sustainable recovery?
So I think the biggest lesson for all of us is that our health system really needs support. Our health system isn't where it needs to be. And the fact that coronavirus came and just shone a light on how dire some of these health, whether it's the policies, the funding, the institutions, the hospitals, the clinics, like the level of investment that we need to make in Nigeria in health, I think has been highlighted by the crisis. The fact that we couldn't travel, like nobody could leave when we had this global lockdown on movement. People couldn't move. People couldn't go and, just go to another country and get treatment. Everybody was struggling. The struggle was the same in other countries. Other countries that we saw on TV were struggling more than we were. And so I think it's just bringing to the fore the idea that we need to be responsible for our own health. We need to be responsible for, investing more in our health system. And I really think that this has been an opportunity to have these conversations with companies or organizations who weren't necessarily focused on those issues before. So I think we'll find a much more open investment mindset into the health sector going forward, because clearly all the people who have been healed in Nigeria. All the testing that we've been doing in Nigeria has been done by Nigerian doctors, nurses, clinicians, physicians. We have scientists working on things. The labs are run by Nigerians. So obviously we can do it. I just think we need more capacity, more investment, more support to the health sector in Nigeria. So I think that would be one first path. The rest, how to open the economy, how to, prioritize which sectors to open first, which ones are more priority. That's not necessarily something that I have, a huge view on, but that's not really my area of expertise. But I think it's about balancing out the need to open the economy and get people back to work, get companies back working, and also the need to preserve people's health so that we don't see the dramatic scenes that we've been seeing on TV in other countries.
The Aliko Dangote Foundation, of which you are CEO, is contributing to reconstruction in the Northeast and the empowerment of IDPs in that area. How has the pandemic impacted your work in that area?
So obviously we've been impacted like everybody else because we haven't been able to move as much as we could have. A lot of things have slowed down because of the pandemic. For instance, even routine immunization for children. So just, the regular shots that babies are supposed to get, we've had fewer of those happening because either resources have been refocused on fighting COVID-19 or people have been scared to go to the hospitals and to the clinics because they don't want to go and expose themselves to COVID. So we've seen a huge decrease in people going to the regular health centers, et cetera. And also movement. You remember that we had lockdowns. We couldn't move from one state to another. So our work has been impacted that way also.
And what are the likely consequences of dropping the ball in that area?
So this is exactly what we're we're working right now on bringing the routine immunization system back in play. And this is across Africa. The fact that children haven't been immunized since March in general, or we've seen a reduction since March of children being immunized, the direct impact of that is that we're going to have more children who will get measles, who will get mumps, who will get rubella, who will get all these diseases that you wouldn't normally get if you had received your regular 5-course immunizations. We also have seen some cases of vaccine-derived polio, which children only get when they don't have full immunity and haven't received the courses of vaccine. So that's another problem we're going to deal with because we need to go and start immunizing children again. Now, we've been having all these conversations with the different ministries, Ministry of Health, the state commissions of health. Everybody knows what they're supposed to do, and we're slowly getting back to things. So I'm hoping that in the next few months, we'll be able to get back to the immunization level that would, you know, make sure that we don't make...
We hope so too.
...make everything worse, right? And reduce the gains that we've made over the past few years.
Thank you, ZOUERA. Unfortunately, we've run out of time and we have to say goodbye now. We thank you for your time and we thank you for watching. Please join us next time when we come around. But between now and then, let's continue this conversation online. Bye for now.